2023. The minor variation orders were covered from the budget line in unforeseen. Question 6, 300 work permits will be granted. Are you satisfied with the amount of local workers that are working on the project? Is there a plan to do another job fair? FINSO, the contractor at the General Hospital, and other FINSO and other main contractors were present at the National Job Fair on October 2nd, 2024. The opportunity remains to have locals take up the jobs at all projects. I would have liked to see more locals working on the hospital. However, we understand that there are not that many trained and certified locals in the construction industry applying. Question number 7, what is the minister's plan to ensure to recoup the funds for SZV? SZV and government are in discussion regarding all outstanding owed to SZV and the monthly contributions to render services on behalf of government. Question 8, what is the minister's thought on the SAHA? Does the minister agree with SAHA as is? I trust the advice of the ministry, and I wholeheartedly believe in the purpose of the SAHA, which is to ensure that we have affordable health care for all citizens of St. Maarten. I believe, however, that there is room to still tweak some parts of the implementation to optimize the sustainability, as it is very important that this project is a success. And if asked to specify, I would indicate here phased implementation. What is the update with the Dutch Caribbean Hospital Alliance? The Dutch Caribbean Hospital Alliance, which was officially established as a cooperation in June 2022, the membership expanded with the care institutions in Saba and Sint Eustatius, and currently 6 members, all from hospitals from the former Netherlands Antilles, AJO of Aruba, CMC of Curaçao, SMMC, and of St. Maarten, of course, and FM, SCF, SCHCF of the Best Islands are all part of the Dutch Caribbean Hospital Alliance. The projects as outlined in the multi-annual plan are ongoing based on the project initiation documents. An updated project plan, including an audited financial report, is expected soon. Question 10, the possibility of 4-day work week. What are the minister's thoughts? The possibility for St. Maarten to implement a 4-day work week exists once this is well motivated by government employers and employees. A fair advice on this would be needed. However, based on a quick overview that was performed, St. Maarten would need to amend several legal obligations for this to be possible. These obligations provide basic occupational safety and health requirements such as sickness insurance and vacation, to name a few. And to answer the question, what is the minister's thought on this? When asked my thought on this, I myself requested to work 4 days a week in my last year working in the Netherlands. However, will this work in St. Maarten? I don't know, because all indications are that we have a shortage of qualified workers in the labor market already, and this would mean that we would need more workers to fill the positions, but more research will be needed to form an informed opinion on this. What progress has St. Maarten Medical Center made so far while waiting on the St. Maarten General Hospital to better their services to the public of St. Maarten? And is there an update with CFO position at SMMC? SMMC has expanded its services as planned since 2017 in accordance with the St. Maarten General Hospital business case. This has led to a decrease in medical referrals from circa 5,800 to approximately 700 on a yearly basis. SMMC provides 19 medical specialty services, and continues to improve on its services in accordance with its quality framework. Regarding the CFO, the Supervisory Council is working on recruitment for a statutory CFO. In the interim, Sint accountants and consultants fill the position to ensure that CFO responsibilities are met. Question number 12 regarding the job fair. Is it in this budget from the NEST, is in this budget from the NEST, the job fair allocated? The answer to that, the National Job Fair will remain budgeted for the foreseeable future. In addition, strides have been made to have the job portal launched, www.nesc.sx. And more information on this will be forthcoming from the division responsible via social media. Question 13 on the help desk. That one was answered earlier. Question 14, can we have the latest update on the health survey? The data collection phase of the STEP survey is scheduled to be finalized at the end of this month. The report is expected to be ready for publication dissemination in the first quarter of 2025. Question 15, are you aware that the CEO position for SZV is soon vacant, and have you started to prepare for that? Yes, the CEO position will become vacant October 2025. Preliminary work has commenced by the Supervisory Board of SZV. The Board of SZV will start the recruitment procedure soon in order to have a period of transfer of knowledge from the current director to the new to be appointed director. Question 16, are there talks of an increase in the monthly OZR payments? Is it important to know the solvability and future of SZV? SZV and government are in discussions regarding all outstandings owed to SZV and the monthly contributions to render services on behalf of government. The Minister of Finance also answered this question in more detail earlier today. Question 17, what are the Minister's top 10 priorities in order? In order of time and realistic approach at this moment, I would like to know the vision of the ministry. Madam Chair, may I ask the MP to clarify so that I'm sure that I have my answer in the right direction, please?
Sure. MP, and this was MP.
This MP Otley
question?
Yeah, and the
MP
question
Otley.
was, what are the minister's top priorities in order? So, no, but I will attempt, and if it's not what you had in mind, then you can let me know. So you asked in order of time and realistic approach. Once you mention time and realistic approach, knowing that I will be minister for a relatively short time coming up, I must say that there are not that many projects that I can finish. However, I intend to work until the end on the projects that are important for the population. And I did not put the projects in order of what is most important, because to me all of them are important, and I just started writing down and I did not count how many I had, but here goes. General health insurance. I believe that this project is of importance to the population of St. Maarten, as far too many people, 11% according to the last census, do not have health insurance. The uninsured pose a liability to our health care funds, as they are less inclined to take advantage of preventative health care and could pose a heavy burden on the healthcare system if they need critical healthcare assistance. This is also the second point mentioned by the governor in the formation document. Secondly, so another project, because I don't have them numbered, amendments to the labor legislation. Labor legislation is quite outdated. An interministerial approach between primarily the Ministry of VSA and the Ministry of Justice has to be formally established to tackle the pressing issues. Age limits can also be adjusted. I met with the White and Yellow Cross Foundation. During my time as minister, I have been meeting with many different institutions and stakeholders in health, labor, and social affairs. And one of them that I met with was the White and Yellow Cross Foundation, and they were able to present their plans for expansion. These plans will make it possible for us to provide more space in the home care and elderly daycare section, which will allow elderly to be able to stay at home longer without moving to the care facility. There is also expansion of the guided living section and elderly care section. In order to make this expansion financially sustainable, I have asked SZV to look at the expansion plans with the White Yellow Cross so that all parties are on one line and we can have this implemented as soon as possible to shorten the current wait time for the various forms of elderly care. And I have recently signed off on the expansion as well for the White and Yellow Cross. Next, I would also like to solve the ILO issues so that we do not have to go back to the tribunal in Geneva. We made great strides during our last visit and have scheduled a follow-up meeting with the regional director in the coming weeks. We are also very proud of the work done on mental health so far in collaboration with the NRPB based on us being able to find the funds necessary with the help of the Prime Minister and the Minister of Finance. On this same point, we are also proud of the new budget post for mental health care that was added to the amended 2024 budget. I now look forward to seeing the further implementation of the project, which includes institutional support of Mental Health Foundation, the Department of Health, and the other mental health stakeholders, as well as the new building. The continuation of the community development projects is another one that is high on my list, in particular projects related to strengthening of families and projects empowering men and addressing issues related to men in our society. Also, projects for the elderly and projects for the otherwise abled. The Department of Community Development, Family and Humanitarian Affairs and CPS Department are doing quite a lot of great work in community awareness. Unfortunately, I find that not enough people make use of these information sessions, and as such, I have discussed ramping up the marketing efforts of the VSR departments. Assist with the reduction of the annual cost of referrals, either via SZV's, together with SZV's referral team or with a new to be established team. If we had the funds, I would have liked to support an organization such as Keys to Freedom for recovering addicts and other vulnerable groups with institutional strengthening first, and once they are administratively up to par, structural financing because they are doing great work in our community. Similarly, if there were funds available, I would have liked to offer subsidy to Turning Point, as well as this organization also contributes valuably to our society. I would have also liked to see the completion of the new St. Maarten General Hospital. This is not directly my responsibility, but wherever I can facilitate while I am here, I will. And I would like to see that an Inspector General is hired at the EVSA, and we are already in the progress of getting this ad out. Additionally, I mean, while I'm going through it, I can think of one other project that was dear to my heart that I was working on, which was to have a facility for foster children who age out of our system when they make 18. Question 18, what is the minister's plans to enhance community engagement? The Division of Labor, for instance, and Social Services, NEST, National Employment Services Center, engage the business community through the work of the business officers